As long as I'm homeless, I can get all the medical care I need. The Homeless Health Care Center offers some of the best medical care one could seek, and it's more like a traditional family doctor, a family physician.
On the outside in Chattanooga is a tough place to be, perhaps never more than when your health is failing. In this third part of an ongoing series on homelessness in Chattanooga, we're talking about healthcare for the unsheltered.
And we actually are what is called a patient-centered medical home. And so we become that patient's family doctor.
This is Dr. Karen Moyer. For 22 years, she's been the medical director in the Homeless Healthcare Center on 11th Street downtown.
We see them for all their care, and we arrange for any kind of referral that they might need to a subspecialty provider. The challenge is that many times, due to lack of consistent health care, maybe before they've learned about us, their conditions might be farther advanced, or they may be suffering from the complications associated with untreated heart disease or diabetes, for examples.
For Dr. Moyer, as it is for Joe Brackett, who's been an outreach worker at the center for the past 8 years, working with the unsheltered can be very frustrating.
And it humbles me constantly. Here are my best laid plans for this individual, something that I feel would benefit them the most. Your leg was just amputated. It's getting infected. You need to go to the hospital.
It's hard for me to understand that. When I know that I can help them and they don't want to accept the help, it's frustrating, but it's something that we deal with frequently.
I brought someone from Erlanger to come out here and tell you you need to go to the hospital because it is getting infected. And they say, no, I'm fine. I'll take care of it. To the point where you cannot take care of it without getting a medical intervention. Do you understand that? Yeah, I'm fine. I'll take care of it.
Every day of the week, Joe Brackett visits unsheltered people in camps across the city. Some of the people he talks to every week are dying.
Those are hard days. Those are the hardest days. Whenever you know, and you can, at this point I can tell when it's getting close to happening. And that self-determination is still in place, and I just kind of have to continue to watch it happen, is the hardest part, I think, of this work. Continually know that there is a solution that could possibly assist with a particular situation that could save somebody's life, but that self-determination is not allowing that opportunity to take place. And so I just keep showing up every Thursday. Here I am again. This is still getting worse. You're still rejecting the opportunity.
We have to be patient. You have to be extremely patient because, the patient might have had bad experiences in healthcare before, and you have to help them understand that they can trust you and that you want to help them. And sometimes you can't build that trust on one visit. So we have to just try really, really hard to be patient, to listen to that patient, and try to not be like I'm the doctor and I'm dictating to you what I know best. We have to come to the solution together. And that's a big part of a patient-centered medical home is that partnership. We get patients who come in wheelchairs. We get patients who need a wheelchair but don't have one. We are lucky to have so many resources. We have a lot of resources. So we have a driver who can go get a patient where they are. We oftentimes take patients to doctor's appointments.
For the homeless and those who work with them, it's one day at a time. This is On the Outside in Chattanooga, written and produced by Richard Winham and Mal O'Connell.
And we try to give them hope. We try to give them hope that we can help them feel better physically if we treat their illness. We provide them with a safe place to come where people care about them. And so I think that it's really important for us to provide hope.
For WUTC, I'm Mal O'Connell.